This Medical Monday is sponsored by the George Washington University Hospital.
Well, going to the emergency room can be really scary. You're not expecting it. You or a loved one could be in pain. There are just a lot of unknowns. So it's important that you do know who the professionals are taking care of you. And here to share more about the George Washington University's Department of Emergency Medicine is the chair, Dr. Ray Lucas. Welcome to Good Morning Washington.
Thanks for having me.
Absolutely. I want to dive right in. We have so much to talk about. Why don't you just start with telling us about your background at the GW Hospital?
Sure. As the chair of emergency medicine, I oversee the clinical care of the emergency department in partnership with our nursing colleagues and hospital colleagues, and also serve as the academic chair for the university for research and teaching future physicians.
Wow, a big responsibility there. Now, I want to jump into your emergency medicine services. What special services does GW Hospital provide there?
So as an academic university hospital, we do a lot of above and beyond sort of things. We're a level 1 trauma center where we take care of the sickest of trauma patients. We do that in partnership with our colleagues at DC Fire and EMS, and have specialized programs such as our whole blood program, where we provide whole blood to the fire department to give to the really sickest trauma patients in the field before they even get to us, and in addition to other specialized programs around stroke and heart attacks and other things.
Wow, so your care begins even before a patient is in your hands in some cases with your partnerships.
Absolutely. We often know about the sickest patients over the radio from the fire and EMS department, so that we are a team on the spot ready to go when they get there.
And I'm sure that also helps just knowing kind of ahead of time, maybe a certain patient is a little more nervous or a little bit scared of heading off to the emergency department. But that's where your amazing team comes in. But also, what should patients expect when they go to the emergency room, and how do you sort of help them through whatever they're experiencing?
Sure. If you end up in the emergency department, what you can expect first is to be evaluated by a specially trained triage nurse who will get your vital signs, will ask you some questions, figure out where you are in the level of severity, whether you're more emergent and less emergent. You may have a few sort of early tests done even at the triage level and in preparation for when you come back to the treatment area. And then you can eventually expect to see me or one of my colleagues to take care of you.
Yeah, a concrete plan in place, because when you yourself are going through an emergency, the last thing you want to think about is, where am I going next? Whose hands am I going to be in? So knowing that you have these precautions and these plans in place, I think can ease the minds of a lot of nervous patients. What sort of types of conditions and injuries do you see most often, especially here in the DMV, and what can residents do to maybe prevent some of those?
Sure. So on the injury side, we see a lot of pedestrians struck by cars, and these days by scooters, which are very prevalent in the district. And on the medical side, we see a lot of chest pain, abdominal pain, shortness of breath, the standard sort of distressing symptoms that someone may have and not know if they're truly having a life-threatening emergency, and they come to our doors to figure it out and provide them treatment.
And Dr. Lucas, something that I find very, very impressive is that you have been at the George Washington University Hospital for more than 30 years. First of all, congratulations, so amazing. You don't hear that a lot. So what's kept you there all these years?
The GW Hospital is a very rewarding place to work. It's a team-based environment. We get to take care of everyone, both heads of states and the local residents alike, with a variety of things with the capabilities that we have as a university hospital. And it's just very gratifying every day to go in and to be there for people and make a difference in their lives.
Dr. Lucas, so amazing to hear about what you do every day and how you make sure that the residents here in the DMV are safe and protected and as healthy as possible. Thank you so much for joining us today.
You're welcome.
Absolutely. And we're going to put more information on your screen so you can learn more about the George Washington University Hospital.